So the webinar series starts tomorrow. We've had a lot of interest in this space, and wanted to tell you a little bit about it. The major purpose is for those folks who are unable to get labs. Clyde was telling me there's a lot of folks outside the US that just can't go get labs. A lot of folks don't have their labs yet. So what we wanted to do is make this webinar available if you don't have your labs yet, or if you're not going to be able to get them. Basically, the major purpose for this webinar is to actually go over inflammation panel results, OGTT results, insulin survey results. Now, as you look at this, and we spend a lot of time meeting and going over the the subscription model and what people should be looking to do in the future. Clinically, when I see a patient, once we get that patient stabilized, the patient really needs to be monitoring the inflammation panel each quarter. They also need to check their OGTT, oral glucose tolerance test, and an insulin survey each year just to see how they're doing in terms of their prediabetes, or in some cases, full-blown diabetes. The other thing that needs to be done on an annual basis is a CIMT. So one of the things that we see happening, depending on how these pilots work out, this webinar series may actually morph into the standard post-stabilization clinical follow-up subscription. It's a very interesting point. As you look at it, that's also the best way to monitor. So for example, say you're 40 years old and you don't know whether you need to have a complete evaluation yet. The best thing to do is monitor your inflammation panel quarterly and get an OGTT and insulin survey each year. So again, same thing, in addition to getting the CIMT annually. For those of you who are saying, inflammation panel, what are you talking about? Again, this video goes, this image goes all the way back to Time Magazine, 2004, 15 years ago. This Time is obviously not a medical newspaper or a medical journal, but they were very much aware of the link with inflammation. The secret killer, the surprising link between inflammation and heart attacks, cancer, Alzheimer's, and other diseases, and what you can do to fight it. So they went into detail. Excuse me. I went to the AISH meeting this weekend and got a little bit of a sore throat. But again, Clyde wanted to get this information out for those of you who still want to join the webinars, but you don't have your labs available. We will go to the next slide. So basically, you can join the videos, get answers to, okay, if I have an OGTT test, or if I have an insulin survey test, what does it mean? I'll just give you a couple of basics. With insulin, with perfect insulin metabolism, you want to have a basal insulin, and that is when you're not eating, when you're fasting, a basal insulin level of 5 or less. Even after eating, you don't want your insulin to have to go over 100. And for example, I've seen, now that I'm able to get the insulin survey panel, I've seen a couple of patients per week that come in that may have a totally normal OGTT, but their insulin values are going up way over 100 to keep that normal blood sugar level. So again, that's the definition of insulin resistance. Just very quickly, for those of you who don't know, why is insulin resistance important? It is the #1 cause of inflammation. It's the #1 cause of plaque, and therefore it's the #1 cause of heart attack, stroke, dementia. These are the things that we need to be looking for. Now, I mentioned the term OGTT. If you don't know what OGTT means, that's oral glucose tolerance test. That's the test where you fast for 8 hours. Then you go in, take a blood sugar, drink the cola, the glucola. It's got 75 grams of glucose in it. And then measure your blood sugar 1 hour later and 2 hours later. The insulin survey, you get a basal, you basically get an insulin at each time that you get the glucose values. And again, the inflammation panel, we talked about that earlier. I've got several videos on that. If you're interested in taking a look at one of the videos or just a course, we have a course which goes in depth into, it's about a half dozen, well, more like 8 videos, 9 videos. And in about 2 hours, you can learn anything and everything you want to know about cardiovascular inflammation. We also developed a course for insulin resistance and another course for plaque. So you can begin to start learning what these key components are. You say, well, that's too much for me. Well, you know what? You can continue to depend on the information you're currently getting, or you can investigate a little bit deeper. Again, the major purpose for this video, this YouTube Live, was just to get that message out there that we don't have to, you don't have to have your labs if you want to come in. A lot of people have had interest. Again, a lot of people outside the country can't get labs. And a lot of people that are inside the country and signed up don't have their labs yet because it takes a couple of weeks to get those results back. I hope this has been helpful. I'm going to withdraw back out, take a look at the, I see that we've got a bunch of viewers, but I'm not getting anything on the comments. I don't know if the comments section is not working. It's well, if anybody has any comments, I'll wait for a couple more minutes. And again, I think maybe I am not getting those. I'm going to go ahead and close on out. Thank you very much for your interest.